I bet you recognize Bonnie Nothoff. If you haven't seen her in person, listened to her, you've seen her picture in many places. So we are so honored with everyone this morning. But Bonnie, thank you so much for joining us. As you probably know, Bonnie is the director of the MDHA Governmental Affairs. She's a past MDHA president, as well as a trustee and an ADHA representative. Bonnie is a graduate of Delta College, attended MSU, has served as a dental hygiene clinical instructor for 7 years. Currently, Bonnie serves as a consultant to the MDHA and owns her own business, Nothoff Legislative Research and Consulting, LLC. Bonnie will be discussing legislation and the MDHA and access to care through PA 161. Please welcome Bonnie Nothoff.
Thank you very much. Am I on?
And if when we have questions at the end, just so everybody can hear the questions, we do have some microphone runners. So Katie will get another one. Thank you.
Thank you very much. And thank you all. It is a pleasure to be here with this group of people because we have all worked very closely together. And Dr. Semler has spent a great deal of time. She and I spend a fair amount of time on the phone discussing lots of the fine points that you were just discussing. And that's the meat. That's where you wind up with these kinds of things. When you start out with a program or when you start out with a legislation, if you think we had this all worked out ahead of time, of course we didn't. And the beauty of it is watching it unfold. The title of this program is It's Closer Than You Think. And I use this depending upon my audience. For this audience, I'd like to have you believe that it's closer than you think for you, because PA 161 is about you and what you can provide and how you can provide it. If I am presenting this to a group of elderly people, it's because I'm emphasizing the nursing home aspect, and it really is closer than you think, so we better be thinking about it. So it all depends on who the audience is, how we go about this. And before I start, I do just want to tell you a little bit about empowerment. And PA 161 truly is about empowerment, empowerment of you. Now, sometimes it's difficult to know that this piece of legislation, this opportunity truly is going to empower you. It's a small step, but it's a significant step. And the significance lies in the fact that whereas earlier on, back as far as 1991, where we had the capability to do this, we did not have the capability that we have today. We didn't have the ability to bring in our own money. We didn't have the capability to have our own PA 161 status and own a company of our own and do it that way. We didn't have the capability of being invited into the community as we are today. And a lot of that has to do with the fact that times have changed. Access to care, and Dr. Semler mentioned it beautifully, it has nothing to do with access to a dentist. And of course, I've never thought about it that way, but that I like your thought process. This is access to care to people who genuinely need it, being provided by providers who genuinely can provide it. So I want you to think about your ability to become a part of this should you choose. And I also want you to think about the fact that it was indeed you who made this possible. This was not something that anybody gave you. I spend a fair amount of time talking with folks where sometimes, very innocently, I'll hear from perhaps an MDA person that, well, you know, we gave you local anesthesia. Now, I have to bite my tongue really, really hard when that happens, because we all know that nobody gives us anything. We work hard for it, we work via the law, and we do it the way it should be done. And just on that same note, you all should have received a handout here on laws that have been initiated by the Michigan Dental Hygienists Association. And there are several laws in the last decade, starting at 1991, that include local anesthesia, doubling our representation on the Board of Dentistry, which is a huge difference in how we practice today. Administration of local anesthesia, education, our education being placed in statute. That happened when we initiated the legislation for local anesthesia. We had, up to that time, never had it said in law that our education was in law. And when we did the local anesthesia piece, we said, now is the hour. Certainly, if you're going to afford us local anesthesia, that should be in law, as should our education. And that was a significant step, because that removes preceptorship, or at least it provides a huge insurance policy against preceptorship in our state. Not all states have that. Additions of scope have been added, administration of nitrous, and of course access to care, RPA 161 legislation, and the pain management requirement in your education. Those are things that, if you looked at that, and when I went to school, these things didn't exist. And you know, I talk to students today who are they're in there taking their local anesthesia just like this is part of the game. Well, it wasn't always part of the game, and the reason it's a part of the game today is because of you, because of your membership, because you employ the people who work in our government. You employ the senators, you employ the representatives, you employ the Department of Public Health folks. So we want to be good stewards and take good care of our employees. The other thing that you may have received, actually, no, I'll take it back. You didn't receive these because I'm hoarding these. This is a recent brochure that we put out, and we pay for these, and we give these to legislators. And what it says on the front, if you can't see this, is when seeking dental care, don't keep your mouth shut. Ask to see the license. Now, this is in there because we are facing some challenges today. The Community Dental Health Coordinator position that is happening around the country, or is being attempted to happen around the country, has not yet hit our shores, although we expect that it will. And we expect that it will in the fairly near future. The Michigan Dental Hygienists Association has taken a position on Community Dental Health Coordinator, saying we're all for access to care. We are certainly not anyone to stand in the way. Just make it a registered dental hygienist. That's all you need to do, and we'll be on board with you. Some other things that our president has asked me to address before I do this is some legislation that is going on around the country. This is hot off the press as of last night from ADHA. Missouri has a bill in that would create a scaling assistant. Now that just sends, you know, thrills through your spine, I know. But just to make you feel a little bit better about that, this has been attempted before in that part of the country. It usually doesn't fly. They're not real concerned. University of Oklahoma has been designated a Community Dental Health Coordinator site, although there's been no legislation. In Minnesota, two bills in Minnesota. Community Dental Health Coordinator bill has gone in, as well as an ADHP bill, the Advanced Dental Hygiene Practitioner. They are running concurrently. Currently, nothing has come out about the CDHC bill, but the Advanced Dental Hygiene Practitioner bill has made it through one chamber and is headed toward the other chamber. It's gone through a committee of the second chamber, and their MDA came in and stopped it and sent it off to another committee. It's not dead, it's in limbo. Illinois has a bill in to increase representation of dental hygiene members on their Department of Finance and Professional Regulation. So all of this is going on around the country. And what I want you to be aware of is what's going on here in Michigan. We need to keep our focus here in Michigan. It is very important that we keep our focus here because we are a very different state. Everyone feels that they are different. We have accomplished all those things that we just talked about in the space of 1 decade. We have had an ongoing good relationship with our colleagues in organized dentistry. We try to keep that. We do everything we can to keep that relationship where it is. But we need to tend to our own knitting. It's very important that we do that. Dr. Semler spoke of testifying before a health policy committee. We were all there. Several of us were there. I testified as well. I did ask, indeed, for their help in a second pair of hands. I don't care what you call it. I don't care what the credentials are, but we do in PA 161 need that. Medicaid billing, we just keep pounding on that. We've got to become providers. It has to happen. The state of Michigan has indeed told us that we are providers, but they cannot pull us up on their current system, and when they can, it will happen. We will hold them to that, and we talk about that a great deal. Those are all my pre-program things, and let me just show you from the standpoint of where we are, what we're doing. This is when we signed the bill for Public Act 161. You see Dr. Semler in the background there. Over on the left-hand side, current, at that time, President Geraldine Champagne. The bill sponsor is Representative Barbara Vanderveen, and over here on the right is the MDHA Legislative Director at that time, Chris Nothoff. Now, why is that picture important? The picture is important because, first of all, you don't get bill signings every day. Your bill has to be pretty darn good to get a bill signing. We were asked to have this bill signing. And the reason was that there was not one no vote. That's how much the people in the state of Michigan, your legislators, understand how important this is. Now, this was at the very beginning. We hadn't even jumped one hurdle at this point. And of course, this speaks to who it addresses. Dr. Semler has a great interest in and a great program for children. This program that I'm showing you here will focus a little bit more on the elderly. These are some of the reasons of the history. Let you read that. We were able to bring this about because there was an earlier piece of legislation called Public Act 58 of 1991. But it had so much red tape that it was real hard for anybody to do anything. And that's what I spoke to earlier about how now people like Peggy Sloma and Dolly Black and the 3 ladies over in Jackson can begin programs more easily. Are there barriers? Yes. Are they insurmountable? No. This is the picture that we showed the tech who just, I thought he was going to faint. This is a patient from Smiles on Wheels, one of the unaffiliated programs in Jackson. 3 hygienists run that program. This is a gentleman who at this time was unable to be seen. They did everything they could to get this gentleman seen. They finally did. I understand he's been completely restored and he's in good health. I wish I had an after picture. But you all know this is what we're talking about. These are the kinds of people who need our care. So Meadowbrook. Meadowbrook was the very, very first program that we began after this law was initiated. And Peggy Sloma kind of fell out of the sky one day. Peggy Sloma and I have known each other for a very long time, and I had no idea she might be interested in something like this. She had no idea it was going to begin in an area near where she lived. We got to talking one day, and we were afraid to finish the next sentence because, indeed, Peggy Sloma has been absolute angel to this program. Couldn't have found a better person to do this. And she's done it. You'll hear more about it. I do have a guidebook. Both Dr. Semler and I do answer a lot of questions, and we're happy to answer them. But sometimes with the interest level that we have, if you want to purchase a guidebook, the proceeds from this go to your PAC, to your Political Action Committee, that helps get legislation like this passed. So if anyone is interested, that's my pitch for that. I just did the second printing of that because we sold out the first one. Now, the importance of this picture is this is the Northland president, Susan Ann Sorge, handing a check to the foundation director, the gentleman, and next to him is the director of Meadowbrook, Dental Clinics North, Patty Ulrich, Peggy Sloma, of course. And the importance of this is that when you start one of these programs, you're right, you do have to figure out how you're going to pay for it. What are you going to do? How are you going to do that? So what you do is you get your act together and you say, well, I got to have some money. And our thought was we had to have some money because that hygienist has to be paid. We don't care what else happens right now, but we're going to make sure she gets paid. The Northland Dental Hygienist Society presented a check for $2,000. It was the very first donation to the very first PA 161 program. And because they did it, we were then able to go to the community. I would go to the community, Peggy's gone to the community. We would speak to the local Rotary clubs, to the local Lions Club, to the Business and Professional Women's Club, to anybody who would listen, and we were able to raise over $40,000 for this program. We were amazed. We didn't know, but what you learn when you go out into your community is that they want this. The nursing home rolls out the red carpet. The civic clubs all have money, and it has to go to good works. They all have to find good works to go to. We had a dentist who had ordered equipment for his office, and the man I went to see as a dentist. And so, of course, he was getting the PA 161 conversation. He couldn't help it, you know. And finally, one day, I think to shut me up, he said, you know, he said, I have some old equipment. He said, it's not old, actually. He said, it's new equipment, but it's the wrong height. I could probably donate that. And I said, oh, we'll take it. This is wonderful. Well, then I left the office and I thought, I wonder what he meant about the wrong height. You know, you know, well, it's off about an inch. And he donated $4,000 or $5,000 worth of brand new cabinetry. People want to do this. So that's the important. This is Meadowbrook. This is an outside view of Meadowbrook. It's a pretty little place. It's one of 34 medical care facilities in the state of Michigan with an absolutely wonderful director. These are things that you know. This I do more for education, but these are the ways that you sell your program, and you can have this. You can have this PowerPoint. Should you decide to go out and try to start a program, I'll be happy to give you this PowerPoint, and you can use it to raise money. I talk about the skills of the hygienist, what it is we do, that the hygienist takes up to 4 comprehensive exams and is licensed. A lot of people don't know that. When you go into a nursing home, a lot of people don't know that. Why isn't the care available? All these things were addressed with 161. These are the new programs. Meadowbrook, Smiles on Wheels, Tooth Time, the Detroit Department of Community Health, and the Traveling Tooth Station. There are others, and I have to update this all the time. These are 2 of the 3 ladies in Jackson. You may know Betsy Southern and Stephanie Moore. I was not doing real well on getting all 3 of them on one page. So, so Kim's on the next page. Those are the 3 who run Smiles on Wheels. And I am going to toot their horn this morning because these folks just applied for 501c3 status. What that means, if you apply for and receive 501c3 status, you can receive direct contributions to your program. It's a process. They're doing it. They will do it. I am very, very proud of them, and we all should be, because if they do it, they're going to be your resource for how to get your 501c3. You like the light? These three ladies went out and they put their original equipment on their charge card. I was dying. They're doing fine. This is not the kind of equipment we have at Meadowbrook, but this is some portable equipment. A rehash of some of the things that Dr. Simler mentioned. The population must be underserved, approved by the state, re-upped every 2 years, and provide off-site supervision. That's a picture of the book. This because I did this in Meadowbrook. This is Peggy with one of her patients. That's the cabinetry. Look at that cabinetry. Brand new. And then people want to come and install it for us. We had people come and do that for free. We had a nice open house here. Now, a new program. City of Detroit, Detroit Department of Community Health. Melanie Colbert is the hygienist involved, and Dr. Ibrahim is the pediatric dentist. I'm sorry for the slide here, it's a little dark. That's Dr. Ibrahim in the middle, 2 assistants on the side, and Melanie in the back. This is a day that I accompanied Melanie. She was going to do the fluoride varnish program. This little girl was a little reluctant. She's cute. But she was okay. She got it done. You can see Melanie painting on that varnish. Wonderful program. And then, as Dr. Semler also mentioned, collection of data is very important so that we can get this information back to the state so that we can move on with it. And there we are, filling out the papers. And here's Dolly. This is tooth time. This will show you the knee-to-knee process of application. And finally, what I would like to leave you with is the hope and the desire that if you choose to do this, you know that you will have support. If you choose to do this, know that your government works for you. So when you make these applications, remember that. It's not scary. Yeah, it is scary. It's not so scary that you should never do it. I hope you'll all take a look at it and be happy to answer questions, and we do have a booklet here. Thank you all very much. Anybody have a question?